Fifth presenter, Sucheta KAUL.
Good afternoon, everyone. I'm Dr. Sucheta KAUL and I'll be presenting my study on allogenic simple limbal epithelial transplantation in chronic vernal keratoconjunctivitis. So as we all know, VKC is a bilateral atopic condition usually having recurrent episodes, and these recurrent episodes can lead to conjunctivalization of the cornea, further leading to visual impairment. This visual impairment because of bilateral limbal stem cell deficiency can be treated with limbal stem cell transplantation, usually in the form of allogenic slet. So our objective was to assess the outcomes of performing allogenic slet in these patients of bilateral total LACD secondary to chronic VKC. In the methodology, it was a retrospective observational study which took place between September 2019 and August 2023. We included 5 eyes of 3 patients with chronic VKC. We collected the data on various aspects, including the treatment history. Imaging characteristics were noted in the form of AIOS2025 and slit lamp imaging. We started all the patients on medical management with sodium chromoglycate, tacrolimus, and topical steroids in tapering dose. In the surgical management, allogenic slet was performed where the limbal stem cells were harvested by SNP biopsy from a cadaveric donor. Out of the 6 eyes, owing to the various intensities, total limbal stem cell deficiency was noted in 5 eyes, which were included in this study. These are the donor details of the same. So the first case had the preoperative BCVA of 2200 in the right eye and that of counting fingers in the left eye. There was dense fibrovascular proliferation seen as in the images above. AIOS2025 showed a very irregular epithelium and dense pannus formation, but a relatively clear underlying stroma. Similar characteristics were seen in the second case as well, where the right eye BCVA was counting fingers and that of the left eye was hand movements. The third case had a varying presentation in both the eyes, so we only took the right eye for our study, which had a worse presentation of vision only counting fingers. Post-operatively, all the patients were started on topical steroids, antibiotics, tacrolimus, sodium chromoglycate, as well as oral steroids. What should be noted is we also started the patients on tablet cyclosporin or methotrexate as systemic immunosuppression. These are the pre and post-operative images in the top and the bottom row respectively, where we can see the drastic improvement. Also seen with the AIOS2025 of all the 5 eyes, where the epithelium is regularized with no further pannus. Visual acuity assessment shows remarkable improvement in all the eyes. We had seen a little fall in the visual acuity of one of the cases because of failure of compliance to the medicines. So in a study by Dr. Basu et al., we noted that there was complete ocular surface epithelialization happening after 14 days of surgery. In a study by Vazirani et al., allergic conjunctivitis turned out to be the second major cause of bilateral LACD. In a study by Shanbag et al., positive results with allogenic slet was seen even with long-term follow-up. This was also noted with our study. Another study by Dr. Pragnya et al. Showed histopathological characteristics of chronic VKC in the form of epithelial downgrowth and leukocytic infiltration seen with the black arrows in the first picture. The solid cyst as seen in the second and the third picture. This was also seen with our patients as well. So in conclusion, chronic VKC can result in advanced bilateral limbal stem cell deficiency, and this may subsequently require surgery. Allogenic slet with prolonged systemic immunosuppression has emerged as a very good treatment option, and that should be considered. Thank you.